Hi everybody. It's the 12th of May and it's about 12:30 or so in the afternoon. And a lot of times I like to do a quick educational video when something comes up that seems relevant for others to know. So this morning it's my consult day, so I saw about I think 6 or so consults this morning, and most of them happen to be breast consults, and I have another afternoon to go. But a few questions came up that seemed to repeat in theme, and so I felt that we could spend a little bit of time talking about some of these common questions that people have about breast surgery. Okay, so when people come for breast surgery, typically they come for an augmentation, they come from a lift, for a lift rather, they come from an augmentation plus a lift at the same time, they come for a reduction, some people come for implant exchange, a revision implant surgery, explantation, fats, grafting, and any number of combinations of these. Okay, so the thing that came up is revision rate. Okay, revision rate meaning what is the likelihood that a patient may require additional surgery for whatever reason it might be, and what is the likelihood of them having revision surgery necessary for any of these various procedures. Okay, so there have been plenty of publications that have come out that speak about this, where they've taken samples from across the country and kind of looked at data of revision surgery and put it together and published them and presented them. So I don't need to go that technical, but I'm just going to give you general trends. All right. So in most cases, in augmentation, these are not validated numbers. These are 16 years worth of experience-based feedback from my point of view. Okay, so these are maybe slightly off from published data, which is okay. I'm just going to share what I feel today's expectation should be for patients. And this is something that I've talked to numerous surgeons who do a lot of breast surgery, and we just share information on a daily basis almost with co-surgeons across the country. Okay, so in augmentation cases, when the consultation goes well, when the decision tree of various things like where the incision is located, what type of implant to choose, how big an implant to choose, if all those are done properly with good solid judgment, the revision rate should be, I don't know, 1% or less. Okay, should be very, very low, because almost always they work out well. The only reason sometimes people may need revision rate in this case is the choice of implant may be wrong. Where sometimes people feel a certain way and the surgeon guides them a certain way, and then after they have the implant they may feel like they want to be larger or maybe smaller in some cases, but mostly larger. So that's one reason for a revision, which is not because something went wrong. That's another terminology I want to clarify. Okay, a lot of times when people undergo additional surgery, the immediate thing that may come to mind is that something went wrong, they had to fix something. That is not the case, and nowadays the word is botched. Okay, I want to steer away from that, because when you're working on a project of profound importance like surgery, you think of long-term results, you think of safe outcomes, you think of natural outcomes, and for that to happen, sometimes it's a process. It may take 1 or 2, 3 attempts to get it exactly right. That doesn't mean it happens to everybody, but just the way to think about it. So every time you do a little bit of revision surgery, it's not because something actually went wrong. Okay, it's because that's the way it was intended to be, that's the way it was planned out, because it works out the best long term. Okay, very important for people to know. So that's one reason, is that people may want a different size. The second reason is if, for example, patients have different size breasts, one is different than the other. So usually there's one larger and one smaller. And if you simply do an augmentation as a choice because you don't want to do any other incisions or do any other correction, then you typically put a larger implant on the smaller side and a smaller implant on the larger side. That's what makes sense. However, that may not be ideal. The reason being, the smaller side naturally has less skin, right? And if you choose a big implant, the skin's going to be very tightly stretched out. So it's always going to look more fuller and perkier. Makes sense, right? Imagine a glove, on a hand. It has to fit just right. But if you overstretch it, it's going to feel very tight and cramped, right? Implant is the same thing. If you have less skin because it's smaller and you put a big implant in, you're really stretching that skin out, so it's always going to look tighter, higher, fuller, and rounder. Okay? And then on the same person, if you go to the bigger side, which has more skin and more tissue, and you put a smaller implant in because you want to get the size right, you're essentially sacrificing symmetry. You're sacrificing, the lift that it's going to give you because of the implant or the projection or the how it's going to look, because you are compromising here because you already have more skin and you're putting a smaller implant in. Therefore, the stretch on that skin is not as great as this one. So naturally, it's going to look a little bit more droopier, or the word is natural. So there's always going to be a little bit of asymmetry. In that case, some people say, you know what, I don't mind that. It's not that bad. I can live with it, because another saying in breast surgery, right, is that they're never twins, they're sisters, right? So in that case, there's always going to be a little bit of asymmetry, and that's for many people okay, because that's what is natural. However, when the difference becomes more noticeable, perhaps in some patients, they may want to correct that. Nothing went wrong with surgery. However, now the choice or the desire or the want changes, where now we want to get better symmetry. If that's the case, we may need to do a little revision surgery, right? So there are reasons why revision surgery may be needed, which again is not because something was wrong or something went bad. It's because we want to improve on the outcome. So that's the reason why sometimes in augmentation surgery you would want to do revision surgery. Okay, let's go to lift. So let me just write this. All right, this is because of size and maybe due to symmetry. Before going to lift again, let me finish. What are some other reasons that could be because of a revision? Some people may have a rupture, right? It's possible. Rupture, is rare. Rarer these days because the implants are made so well, but it does happen occasionally. And so if there's a rupture, you may have to do revision. All right? One other reason that people should know for revision in augmentation cases only is when the breast becomes very hardened. It's called contracture or capsular contracture, where some women are prone to getting hardening of the breast. And that's a phenomenon that is well described, called capsular contracture. And if you talk to friends of yours, many of them may have had it or fixed it or whatever, I'm not sure, but it's something that can happen. Back when I was in training more than 16 years ago now, it used to be fairly common. As a matter of fact, I've read and heard of reports that said that the revision rate for capsular contracture in some cases could be 30-40% back in the day, because there was not much known as to why it happened, what were the reasons it happened. We now know a bit more. We now know that capsular contracture can happen in patients who are prone to forming bad scars to begin with, right? They may have a tendency to form keloids or some kind of very active inflammation that happens in their body with any type of surgery or trauma. It's hard to screen them out because you just don't know how one would react, but that's a possibility, but nothing we can do about that. But in other cases, it's because of what we call clinical contamination, where there's a bacterial seeding of the operative area that can happen for whatever reason. Again, it could be from just the sterile process or breaking it, or it could be whatever. And that bacteria is not high enough to cause an infection, but it's enough to create an environment for itself where it likes to live there, now forever. And the way it lives there is by creating this environment that is suitable, like a home for itself. It's called a biofilm. And this biofilm is this little gelatinous kind of a thing that you can't visibly see with your naked eye, but it forms this process where the bacteria can live, and there's a chronic inflammation that happens there that your body keeps reacting to, and that over time can build up and create this thick scar tissue. I'm simplifying this a lot. Of course, there's a lot more science behind this, but this is good enough for a general explanation. So in some patients, this can happen. So we know a lot about this now, so we try to prevent it, right? We prevent it by doing extraordinarily sterile technique where, you know, we don't even try to touch the implant if at all possible. It's called a no-touch technique. We choose the right implant. We try to minimize trauma to the breast as much as possible where there's hardly any bleeding at all. We dissect it properly so we don't have to push things around and do a lot of things like that, so we minimize it. And in some cases we proactively give patients anti-inflammatory medications or pills to prevent it because we have some suspicion that this patient may form a bad scar. So there's a lot of things we do that prevent it. So there's a reason. Hardening. Of course, you know, despite doing all these things, sometimes you may still get that because, you know, humans are the most complex organisms on planet Earth, right? For all we know in the universe now, because we don't know of any aliens. So for all purposes, we are the most complicated species, and it's a complex process to keep a body going the way it does. So some things we just don't know and we can't control. So, but what we do know is that we know a few things that we can prevent as much as possible, and the risk of contracture has come down tremendously over the last several years. Right now, the risk of it should be less than 2-3% maybe, you know, if that. Okay, so these are some reasons why, you know, patients may need revision surgery in routine breast augmentation cases. So I'm going to finish that part of the discussion today. So what I'm going to do in a series of videos over time is go over each subcategories of breast surgery and speak about it in the same way so that you can understand what this is, and so patients become very, very well informed. Okay, thank you.